Welcome to the Senior Safety Advice Podcast. This is the show where we help older adults and family caregivers make practical choices that support safer, more independent living at home. I'm Robin Schiltz, Senior Home Safety Specialist, and I'm so happy you're here with me today. If you'd like even more tips and trusted resources, be sure to visit us at seniorsafetyadvice.com. Today we're talking about a question I hear all the time. Is Medicare finally covering more home safety equipment? Let's take a look at what's changed, what hasn't, and how to make the most of the benefits that are available. If you've ever gone shopping for grab bars, a shower chair, a raised toilet seat, or a wheelchair ramp, you've probably noticed something right away. These items are not cheap. For many families, the biggest surprise isn't the price. It's discovering that Medicare often doesn't pay for many of the very things that could help prevent a fall before it happens, and that can be very frustrating. After all, preventing an injury usually costs a whole lot less than trying to treat one. The good news is that Medicare continues to place a greater emphasis on helping people stay healthy and remain in their homes whenever possible. While traditional Medicare still has important limitations, there are now more opportunities for some beneficiaries to get assistance through certain Medicare Advantage plans and other programs. The first thing to understand is that not all Medicare coverage works the same way. Original Medicare generally covers what's considered medically necessary, durable medical equipment. This can include things like walkers, wheelchairs, hospital beds, and some patient lifts when they're prescribed by your healthcare provider and certain requirements are met. But many common home safety items don't fall into that category. These are things like handrails, grab bars, non-slip flooring, stair lighting, wheelchair ramps, most bathroom modifications. These things are often viewed as home improvements rather than medical equipment, even though they can dramatically reduce the risk of a serious fall. And this is where many people get confused. You might hear someone say, well, Medicare paid for my bathroom equipment, and another person says, well, that's not right. They wouldn't pay for mine. Both people could be correct because they have different types of Medicare coverage. Many Medicare Advantage plans have expanded the types of supplemental benefits they offer over the past several years. Depending on your specific plan and where you live, you might find benefits that help with home safety modifications, in-home support services, transportation, caregiver assistance, or other services designed to help you remain safely at home. Every plan is different. Some might provide an allowance for certain safety equipment while others offer home assessments. Some will partner with local contractors or healthcare providers, and others might not include those benefits at all. So that's why it's so important not to assume that your plan won't help. Instead, call your Medicare Advantage provider and ask very specific questions. Ask whether your plan offers any home modification benefits, or whether it covers bathroom safety equipment. Ask whether there's an annual allowance for safety-related purchases. Ask whether you need a physician's referral before buying equipment. Sometimes simply asking the right question uncovers benefits people never knew they had. Another important change is that healthcare providers are increasingly recognizing how valuable home safety assessments can be. Falls are one of the leading causes of injury among older adults. Now many physicians, occupational therapists, and care managers are recommending proactive home safety evaluations before a crisis happens instead of afterwards. Even when Medicare doesn't directly pay for every recommendation, having a professional assessment can help families prioritize the improvements that will have the greatest impact. Maybe the biggest risk isn't what you expected. Sometimes it's poor lighting or loose rugs, or just it's a bed that's a little too high. Small changes can make an enormous difference. It's also worth checking beyond Medicare. Some state aging agencies, area agencies on aging, veterans benefits, Medicaid waiver programs, nonprofit organizations, and local community grants may help to pay for home modifications or safety equipment depending on your situation. Many people never realize these programs exist because they never ask. If you're helping a parent or a spouse, keep a simple list of safety improvements you'd like to make. Then, before spending your own money, ask every organization involved in your loved one's care whether financial assistance is available. You might be pleasantly surprised. One final thought. Even when insurance doesn't cover an item, it's worth thinking about the bigger picture. A quality grab bar may cost less than a family dinner out. A motion sensor nightlight might cost less than a trip to the grocery store. Preventing just one fall can spare someone weeks or months of recovery, not to mention the emotional stress that often follows. The goal isn't to go buy every safety gadget on the market. It's to invest in the changes that offer the greatest improvement in safety, confidence, and independence. If you aren't sure where to begin, start with the biggest fall risks first. Improve lighting, remove trip hazards, install grab bars where they're truly needed, and then build from there as your needs change. Aging in place isn't about making your home perfect. It's about making it safer, one practical step at a time. So thanks so much for spending a few minutes with me today. I hope this episode helps you understand a little better what Medicare may and may not cover when it comes to home safety equipment. For more practical tips, helpful guides, and trusted resources, visit us at seniorsafetyadvice.com. If you're looking for qualified aging-in-place specialists in your area, be sure to visit our sister website at aginginplacedirectory.com. And if you found today's episode helpful, I'd love it if you would subscribe to the podcast or to our YouTube channel so you never miss a new episode. Until next time, stay safe, take good care of yourself. Thanks for listening. See you soon. Bye.